Okay, so hello everyone. Today I'm going to discuss about the torticollis in brief. And torticollis is also known as worry neck, and it is a condition in which our neck is tilted or lean on one side of the body like this, and it is occur because of number of reasons. So let me share my screen for further details. And torticollis, what is the main culprit for torticollis? So the sternocleidoid muscle is the main culprit for torticollis. So what is sternocleidomastoid? We also called it as a SCM. It is a muscle, and that originate from the sternum and clavicular and insert into the mastoid process. So first, before going into detail about the torticollis, the causes of torticollis, the first thing we know about the sternocleidoid muscle, the function of sternocleidoid muscle, the action, the nerve supply of this muscle. So sternocleidoid muscle is the only muscle that originate and insert in a anti-gravity position. Every muscle like start from upward direction and insert into the downward direction or in the horizontal direction, but sternocleidoid muscle is the only muscle that originate from the sternum clavicle and insert into the mastoid process, that go into the anti-gravity or upward direction. So what is the origin of SCM muscle? As the name suggests, sternocleidomastoid. Sterno means sternum. Sternum, the manubrium part of the sternum. Cleido, clavicle, this part of the clavicle, and mastoid is for the insertion. So sternocleidoid muscle has two head for origin. One is the sternal head, that is the manubrium part of the sternum, and the clavicular head from the clavicle and superior surface of the clavicle. This is my sternal head of the SCM. This is the clavicular head of the SCM muscle. So both hand originate from here and go in the upward direction over here and insert on the mastoid process of the temporal bone, and few fibers on the superior knuckle line of the occipital bone. So you need only remember that it originates from the clavicle, superior part of the clavicle, clavicular head, and the manubrium part of the sternum for the sternal head, and insert over the mastoid process like this. So you can see the sternocleidoid muscle, like move your neck like this, and you can palpate your sternocleidoid muscle over here. That is my sternocleidoid muscle, if you are able to appreciate in the image. So that is about the origin of the muscle and insertion of the muscle. The third thing is the innervation. Who give nerve supply? Who supply the SCM muscle? The sternocleidoid muscle is supplied by 11th cranial nerve, that is accessory nerve. So the nerve supply for this is cranial nerve, not the peripheral. Cranial nerve, 11th cranial nerve. And how you can palpate the SCM? As I said, move your neck like this on the tilt your neck. If this is my right side, and if you want to palpate the right SCM, then turn your neck on the left side. You able to palpate your right SCM. If you are able to palpate your left, if you want to palpate your left SCM, then turn your neck towards the right side, and if you see my SCM muscle in the image or video. So this is my SCM that originates from the sternum head and the clavicular for the clavicular head, and it go into the upward direction like in to the mastoid process of temporal bone. That is all about the sternocleidomastoid. Now the next this you can see in the mirror that this is the manubrium of the sternum. This is the manubrium of the sternum. This is the clavicular head from the superior middle surface of the clavicular sternal head. The clavicular head is this, and they are go and insert into the go in the upward direction towards the mastoid process of the temporal bone. So remember, sternocleidoid muscle is the only muscle that go in the upward direction, anti-gravity. Now next, What is the action of sternocleidoid muscle? So I'm going to play this video, and this is my right side. In the video, the I'm doing the right sternocleidoid muscle action. So right sternocleidoid muscle, the action for same side flexion like this, right? If I am doing the right SCM function, to right side lateral flexion like this, bending of neck toward the right side, and move your neck on the opposite side like this. You are able to see your HCM. Now I'm playing this video. See in the mirror, same side flexion on the right side and the rotation on the opposite side. You can see the HCM so prominently. This is the function of HCM. HCM is same side flexion. If I'm doing for the right side, bend your neck towards the right side, ear on towards the shoulder like this, and move your neck to feel the HCM, the function of HCM, same side flexion and opposite side rotation, as you can see clearly in the image, the HCM muscle. Okay. Yes. So the next is, now we learn about what is torticollis. What is the main culprit for torticollis? HCM is the main culprit. Other muscle may involve, but main culprit is the sternocleidoid muscle. Then we learned about HCM origin, HCM insertion, HCM nerve supply, and action and palpation of HCM muscle, sternocleidomastoid muscle. Now, the involvement of HCM can be two types that lead to the torticollis, also in two types. So torticollis is two type. One is congenital torticollis and another is spasmodic torticollis. Okay. So spasmodic torticollis is like a temporary temporary torticollis lying. Spasmodic torticollis is a condition in which the involuntary contraction of the HCM occur because of the repeated action of the sternocleidoid muscle. Like when, if we are sit in a bad posture in this position, and if some in some offices the employees look at the double screen like this for more than 2 to 3 hours like this, they are moving like this and they don't know they are using their HCM for a extended period of time. And sometimes we are using mobile and keep two pillow under our neck to elevate our head so that we can easily use our mobile phone, cell phone, tablet, etc. So that all kind of activity lead to the involuntary contraction of the HCM. The HCM undergo shortened position that will lead to the contracture of the HCM or the temporary increase in tone of the HCM, so that our neck is tilted like this. So how my neck is like in this position, because if my right HCM, I'm talking about my right HCM, if because of prolonged use of HCM, I'm using my double screen looking on the computer, or I slept in the bad posture, or any because of any number of reason, my HCM is got in the shortened position. So when anything got into the shortened position, it will pull the part toward its side. If my right HCM is shortened, it pull my neck towards the right side. Anything tighten, things go towards it like this. My right HCM right, my neck, it will pull my neck towards it. If my right HCM, it pull my leg towards the left side. So my neck is like this. It HCM, the shortened HCM pull my neck toward the right side, the right HCM, and my neck is tilted like this. So this is the typical posture of torticollis that happen in the spasmodic torticollis, and it occur the individual age that affect the torticollis spasmodic is 20 to 60 years of age, and it is usually accompanied by neck pain. People have neck pain. They are not able to turn their neck. Even while driving, they are not able to see the side mirror, rear mirror, to see the object like this. They are in a severe pain. They are not able to move their neck like this. So that is all about the spasmodic torticollis. Now the next is congenital torticollis. So congenital torticollis is a form that all related to prenatal development of the child. Sometimes there may be some fibrous tissue, tumor in the HCM, or overcrowding overcrowding for baby in the womb, less space for the baby in the womb. So that baby is so the fetus or baby is in this position, they tilted their neck like this, and uh, they keep their neck for almost 2 to 3 months or almost 1 month, that depends upon their gestational age. And this may result in the breech delivery. What is breech delivery? In which the bottom part will come first, like come first during the delivery process. So while delivering, some tear happen at the sternocleidomastoid muscle or some injury to the accessory nerve during the birth, that all lead to congenital scoliosis, that which means fibrosis or shortening of fiber, that lead to the congenital torticollis. So this is a little information about the torticollis, the type of scoliosis. So we learned about the torticollis definition. The main reason behind the torticollis is HCM muscle, then the origin and insertion of HCM muscle, two fibers, sternal fiber from the manubrium, clavicular fiber from the clavicle, superior clavicle, sternocleido. Sterno means from the clavicle, sternal head, cleido, clavicular head, and mastoid means they are go and insert on the mastoid process. The function of torticollis is same side flexion and opposite side rotation. Then we talk about the type of scoliosis: spasmodic, temporary, abnormal posture, while sleeping or while working, or congenital, that is related to the prenatal care. So this is all about the torticollis, and I covered all the things about torticollis definition and everything, the images from the Carol Otis. Carol